this all-star team today. Keep in mind, I'm a rookie on this all-star team when we kind of talk about experiences and things. I'm going to introduce them. I'm not going to insult your intelligence. We gave everyone programs today with their bios in it. So I'm going to ask you to just take a moment as we go through today's program to read their bios. I'm going to introduce them, and then we're going to jump into some of our panel, the questions and things today. And then what I will make sure that I do is save some time to allow you all to ask some questions. So as we're talking to today's discussion, if I don't get into something that you think is important or highlight, or if our panelists say something that's important to you, please, please, please jot it down. And then don't be shy. This is not a formal setting. This is for us to really dive deep and talk about why it's important for diversity, African Americans, to be in healthcare, especially in Shelby County and public health in Shelby County, and how do we move things forward. So without further ado, let me introduce you to our panel today. I will start with Erica Clavier. Look, my good friend here, who is the owner, founder, and CEO of NAHSE. I love to see Black women in entrepreneurship, so congratulations. Welcome, help me welcome Erica. Dr. Ted Lyons, who is also in entrepreneurship in the medical industry, who is the owner of SHOTRx and a huge partner across all healthcare systems, public health, everywhere here in Shelby County. Help me welcome Dr. Lyons. She needs no introduction. You all know her very well, right? For about 4 years now. Dr. Michelle Taylor, who has experience in pediatric medical care and is the Director and Health Officer for the Shelby County Health Department. And Samuel Pie, who is the CEO. I know him very well, and let me tell you something, I know all of his roles, right? So I'm trying to figure out which part of his resume are we on today. Baptist at Crichton. See, help me welcome Sam. I know all of our panelists very well, so if you see us starting to get deep into this discussion, it's because we know each other, okay? This panel was put together for that reason, to talk about partnerships, to talk about advocacy, to show you how we work together, show you what your role is before we leave here as we talk about what healthcare and public health looks like for Shelby County. So let's dive in. Again, I'm not going to tell you about their bios, but the first question I do want to ask our panel is, how did we get here, right? So kind of tell us a little bit about your healthcare journey, what made you interested in healthcare, and then how you got to where you are in healthcare today. Because everybody's journey is going to start out the same, i.e. I started in pharmacy, and now I'm in public health, right? And operations. That's a whole other story, but we're not here about me. So I'm gonna start with Dr. Taylor. Dr. Taylor, kind of tell us a little bit about why healthcare, why public health, and how did you get to where you are today?
Oh gosh, we don't have enough minutes. So the people who are here from the health department know I can go with stories for days. The story I'll tell you is that I did not get into medical school the first time I applied. In fact, I had another person who will remain unnamed, who told me during my senior year at Howard University, when I was applying to med schools, that I should find something else to do because nobody was ever going to accept me into their med school. Now, you look at my bio and you're like, what? He told you that? He did. And it was because on paper at that time, I had really struggled with some of the core classes, the readout classes at Howard that you're supposed to try to master to get into med school. But what he didn't know is that I had a praying mother, grandmother, father, grandfather, all the things, and that I had wanted to be a physician since I was 5. And I also have a retired 2-star general as a mother. So when I didn't get into med school the first time, I came home, I retook my MCAT, and I taught high school for a year at Fairleigh High School. It was one of the best experiences I've ever had. Before I got that job under emergency certification in Legacy Memphis City Schools, I worked at Macy's Wolf Chase in the China department. So I can set a mean table even to this day. I tell people all the time that I would not have finished finished med school if I had gone straight from Howard University. I have been a high achieving student despite my struggles with organic chemistry. I was tired academically, and I needed that year to breathe. And by the time I got into East Tennessee State University and Howard and ended up going to ETSU, I was ready to be a medical student. And then the rest is really history. Like Tipper said, you can read the bio. If you have specific questions after this about each step along the chain, I'm happy to share, but I have other panelists here, so I'm gonna be quiet for now.
Dr. Lyons, I'll go to you.
Like Dr. Taylor said, I could talk for hours about how I got to where I am, but I started off, I grew up in Illinois, and I was a young guy with asthma and allergies and played sports and all this stuff, and all the time I kept having to go to the doctor and then go to the pharmacist and everything, and my mom was a second grade teacher at that time, and she didn't have a lot of money. So he was always working something out for us, you know, and I was like, wow, this is a nice guy. I think I might want to be a pharmacist one day. And that was all the way up until the 6th grade. Then I decided, no, but I want to be as a chemist. So I kept playing ball and everything, was going to go to Morehouse, switched to Jackson State, got at Jackson State, got into chemistry, started doing research at all these pharmaceutical companies, and pharmacy came back around. So I said, well, I guess I do want to be a pharmacist. So I ended up coming to UT on a 3-2 program. They actually created a program for me at UT. They didn't have a 3-2 program with Jackson State yet, so they created one so that my first 2 years at UT in their PharmD PhD program would count for my last year at Jackson State in chemistry. So did that, decided I didn't want to be a medicinal chemist, get a PhD in medicinal chemistry anymore. I finished my doctor of pharmacy program and was like, Lord, I've never quit anything. So God, would you please make the wool wet and the grass dry, or the grass wet and the wool dry, and let me know if I'm supposed to do this or not. So the next day I'm in my lab and I'm running what we call a bomb reaction, which is this highly pressurized reaction. It's in 6 metal bolts on top in this metal casing, and so is my lab mate. And he is running his first, and he's done his, turned his hot plate on, it's getting super hot. I'm now doing mine, and as soon as I turn my hot plate on, he hadn't bolted his case down, so hot steam shot out, was gas shot out, hit the spark in my hot plate, it blew up the whole lab. Whoa. Now, I'm standing there with 2 footprints in soot, metal across the hallway, firemen everywhere, they coming from everywhere. They see me downstairs like there's no chemicals on you, you're not burned, you're not cut, nothing's wrong with you, what's wrong? I said, well, God told me just then I don't need to be doing this. So I went downstairs and I quit that day. I quit that day and switched over to health science administration and pharmacoeconomics, and I was going to continue to get a PhD into then, but then my son, who's sitting right there, was born as a preemie, and they thought his kidneys were all messed up and everything. So Dr. Merrick and I prayed for 2 days, and I told the dean, look, I got to get out here and get a real job now as a pharmacist because my son's been born and said his kidneys are messed up. So we prayed from Tuesday through Friday. On Friday when they took the MRI, he was totally healed. So we never had to have surgery. So that got me into pharmacy, that got me into already my mom had instilled us to help all the way across the board. So every area I've been in pharmacy, as a supervisor of everything else, I always look for ways to interact with the community and go into schools, teach, do everything I can to help our students know that you can be a black man or a black woman in a white coat.
Thank you for that. All right, Samuel, let's go.
All right, can you hear me? Well, my story is not different at all from everybody else's. I think we'll find that everybody else's story is pretty much the same as each individual that's here. Ultimately, I actually wanted to be a doctor initially at first. My baby brother was born without sweat glands. Ectodermal dysplasia was the title. And NIH was doing studies on him for a while, flying back and forth to DC. So that was one of the first times where it kind of got me thinking, you know, I might want to look at medicine. When I followed my uncle around and shadowed him, because he was already a provider up in Jackson, Tennessee, I hated it. I absolutely hated it. I'm like, I really did not find the passion and joy in it. So I decided to do physical therapy. And so I went to physical therapy school, graduated physical therapy school, ended up kind of thinking too, my father-in-law, he was at the time, the late Dr. Wesley McClure, president of Lane College. And so he's like, Hinga, that's my middle name. He said, Hinga, you should actually consider administration. And so I was like, that's a great idea. And because I do a good job of listening and being told what to do by those that are older than me, I went back and got my MBA. Fast forward, physical therapy, opened up my private practice for a little bit. I was able to sell that and moved over to administration. So I worked in Detroit for a couple of years as a COO. Came back and worked at St. Francis for a couple of years as COO, and then back up to Virginia as Vice President for Centera Healthplex for a couple of years, and currently I'm CEO at Baptist Creighton.
I told you I would. All right, Erica, thank you. Let's go to you.
So cool to hear everyone's stories. Ooh, how did I get here? So my story goes all the way back. I'll spare you the long story. My son says, you might want to cut your story out. But my story goes back to Greenwood, Mississippi, where I'm from, Mississippi Delta. Very proud of that. Yes. And I actually, when I was younger, I actually wanted to be a ballerina, a corporate lawyer, and the first female president of the United States. So that was actually my goal, 3rd, 4th, 5th, 6th grade. And then when I started to get in middle school, high school, I fell deeply in love with science and biology, and ended up falling in love with pharmacy. So like Tipper, I went to undergrad at the University of Wisconsin, initially pursuing pharmacy. So in OChem, organic chemistry was very, very rough for me too. So after undergrad, I took a year off to study for the PCAT, work in a pharmacy, and I then learned about opportunities in clinical informatics, which is essentially healthcare IT, or the software that we see in healthcare. And I was very familiar with one of our largest electronic medical record companies called Epic, because Epic is headquartered in Madison, Wisconsin, and so, which is where I went to school. And so I looked at this as an opportunity to leave the pharmacy, not to leave the pharmacy industry, but as a way to add some additional skill sets for my pharmacy school application, because back then pharmacy school was very, very hard to get into. You can pretty much walk in now, but it was very, very hard to get into 15, 20 years ago. And so I transitioned to clinical informatics, and I was just obsessed. Like being able to marry my love of healthcare and software, I really never looked back at pharmacy. I worked for Nova Health System in the DC area, and they're on their clinical informatics team for a few years, and then started consulting directly for Epic and Cerner. And then I was recruited to a large, early stage startup company in New York at the time, and that was my first time hearing about startups, hearing about venture capital, and that was in 2015. Spent a short time there before I wanted to come back south to Memphis, joined a team at St. Jude Children's Research Hospital on their clinical research informatics team, so helping them manage their software that holds all of the data for their clinical trials. And it was actually at St. Jude that I started to fall in love with solving medical transportation. And you may think, how did you get to that? But my grandmother was a type 2 diabetic double-leg amputee for a lot of my teenage life. And I was always so disappointed with how, my mom had to lift her in and out of our family vehicle, which was not wheelchair accessible. There were no reliable medical transportation options. Nobody really knew how to solve it. It wasn't owned anywhere in the health system. There was no medical transportation department of a hospital or of a clinic. It was usually managed by a social worker or a scheduler or something like that. And so once I saw some of the challenges, once I had gotten to St. Jude and I had learned about some of the medical transportation problems that we had in Memphis and at some of the local health systems, I actually started designing a tool. And as a part of this, that's a longer story, but I started designing this tool that I thought would just be sort of like a local tool that we would use in our medical district, and ultimately decided to turn that into a company, which is today is MedHall, a digital platform for finding and booking medical transportation. And so we have now scaled to about 15 states, so outside of Tennessee, and that was essentially how I got here. So very, a very scattered journey, but that was how I got here.
Thank you. And that's why I asked that question, especially especially for our early careers in the room before I lead into my next question, is because Michelle Obama talks about don't be afraid to pivot, right? So I too am a product of an urban community, an urban neighborhood, and didn't have any sight of what healthcare really was. I just knew hospitals, doctors, right, and nurses. So I say that to go into our next question to talk about, if you could tell your younger self one thing right now, what would it be? So let me give an example before I turn it over to our panelists. I wish somebody would have introduced me earlier to other careers in healthcare other than doctors, nurses. Because somebody would have introduced me to public health and I probably would have fell in love immediately and saved $40,000 in school debt. So I'm gonna turn it over, I'm gonna ask Dr. Lyons first, that question. You could tell your younger self something, especially to the early careers in the rooms and the students in the rooms, what would you say to them right now?
Really exactly what you just said. Make sure you learn everything that's in healthcare. I knew pharmacy, my sister was in dental school, but we didn't have anyone in our family, you know, who was a pharmacist or a dentist or a physician or anything like that. So knowing all the different pathways that you could take, didn't have that initially. I'm glad I got into pharmacy, but if I could tell my younger self something, it would be a provider, okay? Pharmacists have, doctors of pharmacy, we have limited ability as providers. We can do some things as a provider, but not all things. So if I had to tell my younger self something, if you wanted to do pharmacy, also be an MP or a PA or a physician or a dentist, be some sort of provider, because that allows you the ability to do so many more things. The things that I do now, I hire a lot of providers within my company, but it's a lot of things I'm like, I wish I could just go ahead and do that myself. But that's what I would tell my younger self.
Thank you. Erica?
For me, I would say that I would tell my younger self that there is no perfect path and you have time. When I went to undergrad, I was so focused on like, gotta go to pharmacy school, gotta graduate in undergrad in 4 years, get to pharmacy school. You know, I don't know why I was rushing to be an adult. Like this was like, I wish I could go back. You know, this is ghetto. But yeah, I even passed up on an opportunity to study abroad in Australia that would have been fully paid for by my school, but I didn't do it because it would have extended my graduation timeline by 6 months. It's like, you know, and when you're so young, you think you know everything, and I just could not see past like hurrying up to get into pharmacy school, and then I didn't even go to pharmacy school. So yeah, we have time, and also that there's no perfect path. We have time to try so many different things. We feel society pressures us to hurry up and decide what we want to do. We can try something. If we don't like it, we can try something else. Like we don't have to be, you know, we don't have to be so focused on this just one specific path and think that there are no other options.
I like that answer. Samuel?
If I could go back, I would ultimately tell myself to be open to different options. So essentially what everybody else is saying, and that is, I remember when I was so tunnel vision, is the word I would use, and thought I knew everything. I knew I wanted to be in physical therapy. I was reached out, after I got my MBA, I had just sent out a whole bunch of applications to all these places. And one of them was an associate administrator position. And in my mind, I knew what I wanted to do, and that was I want to be a director of rehab, and then from there I want to be such and such. But I was called literally the day after I applied for the associate administrative position. And they said, hey, would you like to come in for an interview? And I said, no. And they said, why not? And I said, because that's not what I want to do right now. And literally, and so I don't know if you all would know this gentleman, and I'm probably mispronouncing his name, but Gary Shore. So that was whose office was calling me at the time. So hindsight, yes, but because it would have given me an opportunity to experience something way different than what's within my view at that moment. So be open to really step out of what your normal comfort zone or what your plan is.
Thank you. Dr. Taylor?
So this is a lesson I've had to learn over and over and over again. Don't be afraid to say you don't know. Don't be afraid to say you don't know. Especially when things aren't going the way that you thought thought they were going to go. So my story is, I told you I didn't get into med school the first time, right? And I was a lot like Erica, everybody on this panel. Like, I knew this is what I want to do, right? So some of the folks at Howard were like, well, there's this really good post-bac program at Georgetown that, you know, when people go to that, then they automatically get into med school the next year, right? So I was like, bet. Go get this post-bac, then I'm gonna get into med school, right? So I go and I apply and I get the interview. So I get to the last person who is actually the person who is over the program, right? I cannot remember this man's name, but I remember his face. He was such a hard interviewer that by the time he finished with me, I was crying so hard in that interview that I could not speak. Now, I know you all can't believe that. I love to run my mouth, right? I could not speak. When he finally calmed me down enough to hand me a box of Kleenex, he was like, okay, now, tell me your mom's work number. Okay, now, I told you all, my mom is career military. She was still in then, right? And so I'm like, and I had told her I was coming to do this interview because we had already talked about, okay, Michelle, what is your plan B, C, D, and E? Because that was how we did it in my family. You know, what are you gonna do? And so plan B was to get into this post-bac program. Now I've gotten in here and started crying in the interview, which is not what she would have expected me to do. And now he's telling me, give me your mother's phone number so that I can call her after you have performed so poorly. Mainly because you are afraid to say you don't know, right? That's the only reason. So he calls her, and this is back in the day, y'all. This is 90s. This is 97, right? So I cannot hear what she's saying on the other end. There's no FaceTime, like it's a real phone, right? And he's like, I can hear what he's saying though. He was like, listen, I've been through your daughter's whole file. I've looked at her ACT scores. I've looked at how she's done at Howard. I've looked at what she struggled with and what she has done well with. And I'm calling to tell you that your daughter does not need my program. He said, I take people who actually need my program to actually be successful in med school. She doesn't. She just needs a break. So I'm calling to tell you that I need you to loan her, because he read me completely, right? And he read my family without even knowing it. I need you to loan her, I think it was like $600 or $800, something like that, to take a live Kaplan course and take that course over the summer, and then she can work, she can come and do whatever you want her to do for a year, and I promise you, if you let her retake the MCAT, she'll do better, and then she'll get into med school, and everybody will be happy, right? So I'm like, man, this man called my mom. I don't want to think about what it's going to sound like. Sam over here knows my mother and your next door neighbor, so he can imagine what that was like, all right, 30 years ago, right? And she was, what I realized after I talked to her later, she was like, okay, he told us what we need to do. This sounds good. And we'll be up there on XYZ date for your graduation, right? I'm thinking I'm gonna get in trouble, right? And he actually understood, because he had been working with students for so long, what each and every student who came through there to interview needed in order, especially as African American students and students of color, period, needed to be successful in med school. And he was exactly right. I did everything that he told me to do. My mom loaned me the money. So for all you all who have kids who are getting ready to go on this journey, it is really important that they have skin in the game, because it made a difference for me. I took my little Fairly check that I was getting. I thought I was rich, right? I had a full-time teaching job with benefits, dental and medical. I was making $30,000 a year. You couldn't tell me that I wasn't rich, right? And getting ready to go and be a poor student again, right? But I paid her back. I paid for all of my med school application fees, because back then you had to actually type it on a typewriter. I'm showing my age. You had to, or you saved it on a disc and then you sent the disc in. You know, it was not online because the internet had just come into existence. Also showing my age, right? So, yeah, don't be afraid to say you don't know. I would have saved so much time, so many tears, so many conversations. I would have been way more successful on some of the interviews that I did over the years if I had mastered the art younger of saying, hey, you know what? I do not know the answer to that question, but I will go and find out.
I love it. I got some key takeaways that I'll add at the end from those two questions. So let's really dive deep into this conversation, right? I wanted us to loosen up. I wanted us to know our panelists a little better. But let's talk a little bit about when anyone says healthcare or public health in the African American community. Let's talk about the tension that we see there. Let's talk about the mistrust that we know our community has, that community has in government when it comes to public health, in healthcare. Let's talk a little bit about the success we have had over the years, many years, because there's a reason for mistrust, right? There's a Tuskegee experiment. There's Black women being operated on without their knowledge as experiments, right? There's plantation where healthcare for those individuals meant a veterinarian coming out, not a physician, right? So there's some reasons in our history why there's mistrust there. Let's talk about what that means for your profession and what you do as public health, healthcare leaders when you're dealing with patients or customers to kind of build that trust. Especially, I want us to talk a little bit about COVID-19, what that looks like for your profession, what you had to do as a leader, professional, to reach out to that community, because we were in the middle of emergency and life and death was on the line. So Sam, I'll start with you.
Well, at the time I was COO for Baptist East, and so that was a very challenging time, as everybody probably can remember. One of the biggest challenges that we really faced were family, especially within the African American community, we have very large or directly connected to us. So usually if grandma goes in, it's about 20 people. And then COVID-19 shows up, and now we're not allowing people to come in and see their family members at all. And if you're lucky, you might be able to get one or two in, and they're having to dress all the way down to get in there and see family members. That was hard to translate, especially to a lot of key decision makers that aren't familiar with having those circumstances. And so it made it very difficult to be able to, especially in a high stress moment, to articulate what that feels like, why that's important, that we need to make sure that we rotate and allow different family members that may not necessarily be traditional family members have access to their loved ones. And so that was by far the biggest challenge. And to be in a position where you have that level of influence was an honor, but at the same time it's a big challenge, because it puts a lot of pressure on you to be able to articulate the needs of your community, so to speak, especially to communicate it in a way that other people get it, and that's very challenging. That's hard, and so it's something I wish I always wanted to do a better job at, and I hope to continue to do a better job. That was probably the biggest challenge I had.
Let's see. You raised a good point, right? Everyone wanted to get in and see their family members, and to tell us no and not understanding why created a lot of other barriers and more mistrust. So then more mistrust on top of healthcare was put into that. So Dr. Taylor, we'll go to you.
Why go to me? Everybody saw that play out on TV. Okay, so I started as health director here in August of 2021. And what a lot of people don't remember is that I came over from the military side back to the civilian side when I started as director. So I came from a national position telling providers and military leaders how to make sure that they had enough providers to take care of the troops that were flying missions and doing this, and how to make sure that those missions were safe. And also, if we were going to provide providers, whether it was EMTs or doctors or nurses or PAs, who was available to work some of those mass sites and all of that. So I came from that, and then I got plopped down into Shelby County, which this is home, right? So there were some things I knew to do, but what was also interesting for me is that I actually had been watching what was going on here, because my family is from here, right? So I had already been watching the COVID briefings out of Shelby County, right? I would sit in Maryland and watch them. I would talk to my mom about, okay, the vaccine is getting ready to be given. They're doing it this way. And I had worked at Shelby County Health Department before, so I knew a lot of the people who were working what was going on with COVID. And so I also could see some of the problems that were arising. And of course, I'm watching from Maryland. So when I got here, I knew that we as a department had a huge trust issue because of everything that had gone down before I became director. And I knew that that was job number one, to not only continue to take care of the population and make sure as many people got vaccinated and protected themselves as possible, but also at the same time rebuild the trust and help people to understand that we were still in the business of making sure people could protect their health in the best ways, even if they didn't agree with all of the methods that had gone on before I became director. It's a balance, right? I would say that I had the advantage of being from here. So I knew that one of the things I had to do when I went on TV was to talk to everybody like I would my grandmother if she was watching me on TV. Seriously, that's what I used to do, y'all. I would get up there, and I remember it was every Thursday, it was 30 minutes. I could do, and then Doug McGowan was with me, and I could do slides, right? Doug McGowan, now the MLGNW guy, he was my COVID partner, right? I could do slides, but if I didn't take the whole 30 minutes for the slides, then I would have to talk into a cold camera, because very few people in the studio, and answer questions from the media, right? So I would pretend like I was talking to my grandmother, either my maternal grandmother, Freddie James, or my paternal grandmother, Atherine Morgan. And I would pretend like I was talking to them through the TV, because I grew up knowing what they would say about people on the TV, right? And whether they trusted them or not, right? So if I pretended like I was talking to them, then hopefully that trust would start to rebuild along with the work that we had already been doing in the Shelby County Health Department. So a lot of times building the trust really, and I would tell this especially for your early career people, it's not about the title, it's not about, you know, even your performance all the time. It really is about how would you want somebody to treat your family member, your child, your grandmother, your parent? How would you want to talk to them with knowing that they have no experience in this arena, right? How would you want somebody to talk to them in a way that would make sure that they were educated about the issue, that they were willing to act on that education, and that they felt like they had been taken care of at the end of that conversation? If you do that right, everything else will fall into place. Nobody will question your professionalism, the job will get done, and you will build trust at the same time.
Thank you. Dr. Lyons.
And that's a great place to start, is right there at trust, because when it comes to our community, that's what's lacking the most. And you gave a number of the reasons why. But another reason why is because we don't have conversations that are at the level and at the moment. And what I mean by that is, whomever I'm talking to at that moment, that's the level that I need to be on. A lot of times we want to stay here and we're talking to someone who may not even finish the 6th or 7th grade, or they may only have a 4th or 5th grade reading level, but you're using words this long and throwing things at, no, I need to have a conversation with you. If I have a conversation with you, then you can possibly trust me. Also, when you talk about COVID-19, America and I, we always say we were made for such a time as that. We had already had a pharmacy before, and we sold it back to the company that I was clinical care coordinator for the entire division, which was like 110 stores over 5 states. I created their immunization program. The one program that you see in those particular pharmacies right now, I created that in 2001, 2003, and they took it and modeled it for the whole country across all 2,300 of their stores. So when this came, I wasn't even in pharmacy anymore. I got sick and tired of pharmacy. America was still a pharmacist. I had already started a trucking company. I had 6 trucks on the road, and my cousins who were truckers. So I'm one of the few pharmacists that you know who also has a CDL. I still have my CDL. So if they ever get twisted, I can go grab some slab and make some money every day of the week. So I can teach the class, okay? So I was out trucking and having a great time. And so America's at home and everything, and I called back. I was actually going from Indiana over to Illinois, about to drop a load. And I had been on the road, and I thought I was on the road because God had me write a book while I was out on the road. I said, this is why he had me out here. That must be it. No, that wasn't it. This is what was happening. Got on the road, I'm praying, and God says, yeah, you're going back home. You're American. I'm going to open up a clinic. You're going to tell all these people about COVID. There's a vaccination coming. It was actually before the vaccination was even there. And I called. I said, look, God just told me this is what's going to happen. We're going to come back. We're going to open up a clinic. I'm opening up for you. Then I'm going to get back on the road. That ain't what God said. Y'all heard what I said. God said, it ain't what he said. So that very night after I told her that, she, number one, said, okay, cool, fine, we're going to do this. So she already started paperwork, sending it into the state and everything. Like that night, I'm driving over to Indianapolis. Another 18-wheeler hits me from behind, knocks my 18-wheeler up in the air. I land, jam my shoulder and everything. My truck is still functional enough to make the load and make it back home, but my shoulder is jacked up. I called her that next morning. I didn't want to tell her that night. I called her the next morning. I said, yeah, when I get back, we're going to open up that clinic like God said. So that's how ShotRx came to be. I came back, we opened up, that was the last day of January in 2021. And she filed paperwork. We got it back in February. We opened up March 21st, and the story goes on from there. But what we did was, and what I had done with the company before, was we were fighting flu then. We had the avian flu that was going around. It was almost a pandemic with the avian flu that y'all don't even know about. But we were going with the CDC into various areas of the city. I was one of the 6 companies that was working with them to go in different areas. And what we found out was that if you went in and you talked to folks, we were targeting our folks, who's black folks, Indians down in Mississippi, Choctaw, and Hispanics in this area. And you had to go into communities and talk to people. All the experts on TV didn't mean a thing. That's all you had back then. All the experts on TV, the radio, didn't mean a thing. But when we went in and we had conversations with people, I always tell people conversation rules the nation. You go and have a conversation with somebody, then they start to trust you. And if they don't trust you, if I go in with Michelle, and she's from this community, and her mom is the general, and everybody knows her because she done fed everybody in the community. Now, she and mama get vaccinated, everybody else say, okay, we trust them. So he must be okay, I'm gonna listen to him. And we would do that from community to community with that. So when we got ready to do this with COVID, we did the exact same thing. I probably did during COVID about 68 different town halls like this, explaining what COVID is, what the vaccinations are, dispelling the myths. Shoot me every question that you want to shoot me about any type of vaccination, so that people would get comfortable and they'd hear it coming from their brother. And that's what's different. When it comes to our community, and we said this the other night, we have a group called Black Men in White Coats, and Dr. Jacques is out there as well. Have about 100 brothers around the city who are some form of doctor in some way. Pharmacists, physicians, special fetal maternal, one of only 5 in the region people, you know. we all talking and say, you know, nobody takes care of us better than us. And that's the truth. And you put some statistics out there that I read earlier that say that very thing. When we take care of us, we live longer, we live healthier, all of that. So with COVID, we did that. We went out to every community. We was over in New Chicago, Hollywood, wherever you want to go. I said, I'm 10 toes down all around town, wherever you want to go. Went to every church. We got 3,500 churches in Memphis. I went to 1,500 of them. I was in church more than all y'all. I'm already a minister too, so I'm in church more than all y'all anyway. But I went to every church, and we even went to, quick story on this somebody's talk. So, one of the best churches we ever went to, there was an African father at a Catholic church in the middle of North Memphis I never knew existed, but it's off in there. And so he says, hey, we have a Hispanic service and we need to get some people vaccinated. Could you come do it? I said, sure. Spur of the moment, we took 30 doses with us. 33 as a matter of fact, because I had 3 of them extra from no one I just done. Took 33 over there. It was too much. It was too much. We got there and he said, nobody wants to get vaccinated. He said, do you mind talking to the people? I said, I speak a little Spanglish, but I will try. He said, no, we have interpreters and everything. Cool. It's just me and Dr. American that went there. After speaking to them for 30 minutes, answering every single question, he had gone through their WhatsApp chat where they were doing all this, telling the wrong stories about everything, and had me dispel all of that. It went from 33 to 133 people getting vaccinated right there on the spot because we had a conversation. And it wasn't that they trusted me, they trusted the Father and the interpreters. And I was just a conduit of information for them. So that's what makes a difference in our communities, is that when we're taking care of each other, we understand culturally what's going on. Why it's important that grandma couldn't have the other 5 or 6 people in there, because her aunt and her sister knew her real medical history. See, the kids didn't know that she was allergic to penicillin, but her sister did. And then her aunt knew that she also had this as a child. You gotta have the rest of the family there, because you'll never get the whole medical history. That's what's different about our community and other communities.
And I also learned, Dr. Lyons, if you have a CDL, you speak Spanish, and entrepreneurship, no matter what it is, you can do it. That's what I learned. All right, Erica.
I'll just be quick on the theme of mistrust. Especially, we see this a lot in technology, especially as you guys have heard a lot about AI. And we always have to think about who is it that is building these solutions. When I first started the company, I took about a year just to go out into the community to interview patients, their caregivers, to interview medical transportation companies, their drivers, because I really wanted to understand the challenges that they had. And it was so interesting when I would go to, we are a for-profit company, and so we raise capital from investors. And when I would go to investors, and they would say, why would you talk, why are you having these focus groups? You're wasting time, start doing stuff, basically, start building. But then I asked, how would I know what I'm building if I don't know, I have some idea, but I'm not building it for myself, right? So, and so that's a theme that I've seen across the technology space, especially because unfortunately the majority of the founders and entrepreneurs who do get the most funding don't look like anybody in this room. They're usually white men who are already fairly wealthy, have not spent an hour in any community that has come. We always say that we build with the patient. We don't say we build with the patient in mind, because what's in my mind doesn't matter. Only thing that matters is what the patients are experiencing. And we've seen how beneficial that has been in the implementation of our product, because we've been able to launch in, as I shared earlier, multiple states, multiple cities, and multiple communities with a small fraction of the resources that many of our competitors have. Our competitors have raised 3 to 4 times more money than us, but they have not been able to accomplish as much because they don't understand these communities that they're trying to implement their solution in. As far as COVID is concerned, I usually don't like to say that there was a silver lining, but there were some insights that came out of COVID that I think were very helpful for social determinants of health, health equity, health disparities. Those were terms that a lot of people didn't even know. And that was so crazy to me. A lot of people didn't realize that patients had to ride the bus to go to a doctor's appointment. Having to explain that to somebody felt so crazy to me, but to tell them, hey, this patient has cancer, they can no longer ride the bus. They need to ride in isolation. And so that, while there was no silver lining in COVID specifically, I think it did shed light on a lot of issues that we had in healthcare, and I do think that was beneficial.
Thank you. So what I heard too about the trust piece is a lot to do with cultural competencies and cultural awareness. We are years in this trust. It's going to take us years to build it. part of that is getting our counterparts, our non-African American physicians, providers, professionals to understand those different cultural competencies. How do you ensure that in your organizations, and how do you see that moving forward to ensure that we're bridging the gap on that mistrust as it comes into knowing those patients you serve? So Eric, I'm gonna start with you because you just touched on that.
Yeah, with us, it starts both with where leadership is and with where the resources are, because whoever, unfortunately, in our space, whoever has the resources, those are the folks who are making the decisions, and they get to make very quick decisions, very big decisions, and so when we are not in those rooms, they get to make whatever decisions they want to make, and it doesn't matter how it impacts us because they will never see the outcomes, and they don't really care if those outcomes are positive or negative. So for us, it is ensuring that people who look like us or people who come from all walks of life are in the rooms where the decisions are being made, and also the ones who are able to deploy capital in our space, because the folks who have the capital don't understand why health equity solutions or why digital health solutions that impact people of color or people from complex backgrounds, why those solutions need to be developed. They don't understand that the infant and maternal mortality rates in African American communities, the fact that I still have to explain this, or the rates at which African American women die from breast cancer 3 times higher rates. Like we know these statistics, but there are so many people who do not know these statistics. So we have to be able to show up in these rooms where we do have a voice and where we do have impact. And yeah, we just have to keep showing up, and we have to be in the spaces where we can make the decisions. That's what I see from my perspective.
I'm gonna come to Sam and ask that same question.
That's a loaded question for me specifically, but one of the biggest challenges is being able to articulate and educate others that really don't grasp that understanding. And so I would say one silver lining out of COVID was the social determinants of health. Key questions that are required are you homeless? Do you have a difficulty affording your food, difficulty for transportation, difficulty for affording household income? So all those things that kind of drive towards how well you live or potentially impacting your outcome. The largest percentage of those that are below the poverty line are Caucasians. However, the largest percentage of individuals are African American. And so by default, those social determinants of health hit our communities the hardest. So I guess from that perspective, it allows us, especially with all the challenges now to DEI and the concepts of what DEI is versus what DEI realistically should be and is not purely just based on racial. However, a lot of individuals feel that it is. So to be quite bluntly honest on that, the social determinants of health by default kind of force us to help support those individuals in those areas that are predominantly African American or minorities. And I'll wrap this up here because there's one more portion of that that I do want to speak to, and that is the fact that especially when you're looking within the communities, one of the biggest challenges that they don't have a lot of access to individuals that look like them. And finding a PCP, primary care physician, is very difficult, extremely difficult. So that's why I'm glad your son's going back to be able to participate in our arena. To have those individuals out there to be able to speak to the communities and support them makes a huge difference. And so we're ultimately going to be relying on our word of mouth, on us encouraging our children, our family members, and even within our organizations on what we can do to support those that support our communities the best.
So, Samuel, you speak on a good point, and before I go to Dr. Taylor and Dr. Lyons, I'm gonna bring up this fact that we talked about as a panel, that studies have still shown that less than 50% of counties across the nation still don't have at least one Black in that county to service the population in which they serve. And then those same studies show that the one physician or 1% of physicians that they do have, that service those individuals, so Black doctors servicing African American patients has success rates, but not because it's Black serving Black, but because of the advocacy, right? The advocacy in the community, the culture, competency, awareness, that leads to success. So you talk about something, Sam, about how important, what Erica said, for us to be in the room, one, we're gonna get into how we get in those rooms in a minute. Then Sam talked about the importance of us educating, two, Dr. Taylor, Dr. Lyons, and Dr. Taylor, I'll start with you, to talk about how important advocacy is, how do we do that in Shelby County, and then how do we get more physicians, more entrepreneurs, more administrators to the table to say, I don't mind joining your panel to educate. I don't mind coming to that church to speak. I don't mind, because it's more than just serving patients, serving customers. Dr. Taylor.
Oh, the advocacy piece, so important. I'm happy about this question. So, what a lot of people don't understand is that when you go to med school, DO school, pharmacy school, PA school, they do not teach you that advocacy should be one of the largest pieces of your profession. The largest piece, all right? They do not teach that in a lot of these professional schools. They don't. But I will tell you, and the people in this room who work with me know, that is one of the biggest pieces of my job, all right? Every time I open my mouth to say anything, I'm going to give you some kind of data point, whether I'm talking about the fact that we are number 2 in the nation for new HIV infections, right? Or that African American women, babies, are 2 to 3 times more likely to die for their first birthday in Shelby County than white babies, right? But I also am really good about telling you the stories and definitions of what health equity is, what it means, and what it means to advocate for health equity in the community for everyone. As far as the original question about how do we get past some of this, it means not only having the people in the room, but making sure those people know how to advocate for what you're trying to do, right? And letting the data lead you, right? But data is super important. So this is where it gets boring but interesting all at the same time. Whoever controls the data controls the narrative. If you don't remember anything else tonight, remember that. Whoever controls the data controls the narrative. I can tell you chapter and verse how many fights we have had at the Shelby County Health Department over data that belongs to you all and the people in this county. And the fact that not only does it belong to you all as taxpayers, but hearing the real data belongs to you. It is a right that you have paid for as taxpayers. But I would tell you that a lot of people don't want you to hear that, right? But if I, as a leader of the health department, have control over that data, it is my responsibility to make sure that I hire people like Gilberto over there, who has experience with Native populations within Spanish-speaking communities, right? So how many people know that, you know, and I grew up in Memphis, so for a long time it was just black and white here. Now we have a significant Hispanic, Latino, Spanish-speaking population, but not all of them are Spanish-speaking. And a larger proportion of them speak native languages, right? I wouldn't know that if I didn't have access to the data. So you have to make sure that you understand that whoever controls the data controls the narrative. Most of the time what happens with that is, and Erica knows this well, the data gets silenced because the people who need to be able to see the data to know what's really going on don't ever get to see it. So wherever you're working, at whatever level you're working at, always ask for the data. And it can be just as simple as, well, you know, and it can be innocent. I'm really good at acting innocent when I'm really not, right? So if I was running, say, a car seat program, I would innocently ask as the public health coordinator, well, you know, do you mind if I look at how many car seats we're giving out in each and every zip code, how much money we're spending in each zip code, and do you mind if I put all of that together in a report? I would ask something like that if I was a public health coordinator and I wanted to impress my boss. But I would also be asking so I could really know what's going on. Why is it that people in 38109 are accessing our free car seat service more than people in 38017, right? Because that's when you start to really get at answering some of the questions that you need to answer. But you can't answer anything if you don't have access to the data. And if you don't advocate for access to the data that the taxpayers paid for.
That's very true. So advocacy and showing up, you use one of my phrases I love, you gotta show up. So one of the things that we decided to do, America and I decided that we were gonna find a way to make sure there are enough African Americans in Shelby County, Memphis, that are physicians and dentists and pharmacists. And we're gonna make sure we have enough Hispanic speaking MAs out here too. So we did two things. We decided to take a lot of our revenue, because we have a for-profit company too, and I'm a bad businessman, I give away too much stuff. And so we decided to create a Health at Home Award for about 15 HBCU students that are from Memphis. So we have students at Jackson State, Texas Southern, Russ College, who else, America? We got TSU, we had TSU in here. So those students can get finished with school without having a big bill, and they promise to return home, apply to medical school here or wherever they go, but return home and actually practice. They want to come back home. So they write essays and do all this stuff to let us know that, oh yeah, they really do want to come back to this area. And we cover North Mississippi, Arkansas, and Memphis. So anywhere in this area, if there's a student that does that and they want to come back and practice here, we have some scholarships at various different schools that you can go to and get those as part of the Health at Home Award that's for Memphians coming back to Memphis to practice some form of healthcare. So we're real about showing up. A lot of times people talk, good talk, and do everything else. We put our money where our mouth is and where our heart is. Our treasure lies in this community and our kids, so we put our money there. We went with Miss Housley over there from Concord, who's awesome. We somehow came across each other. I don't even remember how it was, but we got to talking, and what she let me know, the data, is that a lot of the Hispanic students who are medical assistants, they get to the last part of school and they run out of money. And when they run out of money, they end up just going back into the community and doing whatever they can to make money, but they never make it back to school. I was looking for more Hispanic medical assistants because we're serving every community in Memphis, and during COVID and everything else, we have a lot of these children in school and their English is a second language. Their parents are speaking Honduran Spanish and everything is, like you said, the native language and everything else. It's not just Mexicans. No, it's everyone. And it's everyone from everywhere. So we said, let's do this then. How much are they missing? She said, it can sometimes just be $1,000 or $500, or yeah, one that was $5,000. They said, but they just can't make it through to the end. They're not going to come back to school. So we created the Shot in the Arm Award at their school so that we can get those Hispanic MAs into the community. Now understand, I can't hire all these folks. So I'm putting Hispanic MAs in the community for all of Memphis. So America and I are supplying Memphis with Hispanic MAs. Why do I tell you that? Because they're going to be the advocates. Our black doctors and dentists and pharmacists, our Hispanic MAs and nurses and physicians that get out there, they're going to be the ones who are the advocates. We will advocate for each other way better than anyone else would. One of the stories I'm going to tell, and I'm going to tell your story, Dr. Sampson, Dr. Job over there, as we were having our meeting the other night with the black men and white coats, I almost came to tears listening to two prominent physicians talk about how one had to advocate for the other so that his wife could get what she needed so she wouldn't die in childbirth. One physician advocating for another physician because they were black, and a particular hospital here was mistreating or not treating them as well as she should have been. But because he is a
maternal fetal medicine.
Maternal fetal medicine specialist, one of only 4 in this region. My God. He was able to come in and say, no, you all are gonna do A, B, C, D, E, F, and G, and by the way, this is my brother, don't mess with him no more, and walked out the door. And they took care of them the rest of the time. We have to be able to do that. We have to show up. That's why I like that. We have to show up. And we have the opportunity to advocate at every level, whether it's in the pharmacy, whether it's at the bedside, whatever. We have to advocate because no one else will. And if you don't, then someone may not be here tomorrow.
I want to talk about that. Let's go deeper in that conversation because one, it's 2025 and we're still dealing with the first black whatever. Right? We're still at the first black, right? We're not yet at majority black, all black. In a community that's majority black. You talk a little bit about all of you recruiting and getting us African Americans into the rooms that we need to be in to advocate and learning how to advocate. But let's talk about some of the challenges that you have faced with showing up, being the only black face in the room, having to challenge to advocate for your community, the pushback you got, the unsuccessful rate you got, and how you overcame that. Because as a student, early career that's hard to do. I want to show up and advocate for my community. I was never taught this, and I want to do right, but once that challenge hits me, how do I take the next step? How do I overcome that? How do I show up again? So let's talk about an experience you had that looks like that. Let's talk about where we are with still being the first blacks, how we need to bridge that gap, because Dr. Lyons, you're doing a lot of work, but we still have a huge gap here in Shelby County. Me finding an African American physician to deliver my child was hard work, and I work in public health, right? Dr. Taylor almost had to deliver my child. Erica, I'm gonna start with you on that.
So I would say that while we need to continue to show up and advocate, we're gonna have to bring in our allies. As much as we may not want to, as much as we may think it's not necessary, we just have to. We just simply we still have so much work to do to be in the rooms that we deserve to be in, and we have to have our allies. I will share a very personal, quick story about how I went into a local emergency room. I have endometriosis, and I had a surgery related to endometriosis, and a week later I was having complications from that surgery. Went to an ED here locally at 2 in the morning, and it was an empty ED. There were no other patients there. I was treated very poorly. It took me 6 hours to get the results of my CT scan in an empty ED. My surgeon, he then showed up. I called him to let him know that I had been, I had showed up to the emergency room. He is black, my surgeon. He was treated poorly because he didn't have on his white coat. He put on his white coat, and magically people just started to behave differently. But after that, I remember as soon as I was admitted to the hospital, as soon as I got to my room, I told my husband, bring me my laptop. And so he went home, got my laptop. I sent an email to the CEO of that hospital. Within 15 minutes, I got a phone call. And then within like another 10 minutes, somebody was in my room. And I had to always think about what happens if you don't know the hospital CEO's phone number. And so we do have to realize that while many of us are in certain spaces, we know a lot, we understand a lot, we know the statistics, we know how to go out and advocate, we do have to bring in allies or other people that can support us and extend the mission as well.
Dr. Lyons?
I'll give you all a personal story out of corporate America. I have one for every stage of my life, but this one in particular because it's right here in Memphis. I told you all I was over the entire region. I was the first black, first black supervisor they ever had over the whole region. Come in, nobody can do what I do. They had no one who could train pharmacists, do any stuff. Excellent job. Took their program from where they were making $5,000 a season in a particular program, so I was making them $1 million every 3 months. So, kind of knew what I was doing, huh? Come to find out, they were paying me $10,000 less than all the white supervisors. Now, this is why we have to show up for each other. I was advocated for by someone in HR who is willing to risk their job to say, hey, you know they're paying you less than everybody else. And they showed me. So then I had to go and talk to the only two people who outrank me in the whole company and tell them, I'm not happy. Oh, Dr. Lyons, why are you not happy? Because you owe me my dime and my time. Because you're not paying me what you're paying them. Their faces turn, beat red. Oh, what do you mean? No, what do you mean? Not to pay me what I'm worth. Actually, you're paying me less than what I'm worth, even if you pay me what you pay them. So I'm not happy. Stood there for a moment, they blustered back and forth, tried to go through the other. Tell you what you do. You all figure it out before I leave today. I'll be sitting right there. So I went to my seat, sat down, played the angry black man for the next hour. Every time they walk by, they tiptoed over to HR, they tiptoed back. There was a gentleman who was black, he's about 6'4", his old HR saw him walking across the fence and said, he about to come over and tell us something. So he came on in there, he talked to them, and he went back over there, they called me back in, and they said, well, we'll apologize, it's too close to the end of the year for us to go ahead and make it right financially, so you can just take off as much as you want, and as far as time, I said, okay, well, that's my time, what about my dime? And he said, well, our fiscal year starts in another 2 months, so we're gonna make sure to go ahead and give you your salary. Tell you all that to tell you, it doesn't matter what the title says. You will enter rooms where just because of the color of your skin, your gender, you're going to be paid less than you're worth. You pay less than you're worth probably anyway, if they paid you right. But they're going to pay you less than you're worth just because. And they'll come up with every reason why. And it takes somebody being brave enough to advocate even for you, Dr. So-and-so, so that you can go in there and stand up so they won't treat anybody else like that. So then other people start looking at their salaries across the other departments. And they start finding out, well, I'm not being paid like I'm supposed to be paid either. And some things changed around there. So maybe that's the only reason I was sent to that company, really, was so other people could get their money right. But I tell you what, be an advocate and show up for each other.
Dr. Taylor?
Oh goodness, such good points. I have so many examples, but I'll give a personal example as well. I'm a breast cancer survivor, and I had the privilege of not only being a physician, but being married to one at one point. We are co-parents now, no longer married. So when I was diagnosed, we were still married. And I knew from the beginning, because I know what the timeline normally is for women, particularly women of color, when they get diagnosed with breast cancer, okay? And it is not the timeline that I had. So my timeline was, I'm sitting in our old health department building, for those of you all remember the old one, it was 70 years old, 5th floor on a Monday. I get a call because my former husband, now co-parent, is a radiologist. And I get a call on my personal phone while I'm sitting at my desk getting ready to start my workday from his partner, right? And this is what she says to me. She said, Michelle, I'm reading your mammogram from Thursday. Okay, so this is just like, we just went through a little weekend. I still have pictures in my phone from that weekend. I'm looking at your mammogram. I don't like what I see. I was reading it, and then I looked at the name, and I realized it was you, and I called you. Now, that doesn't normally happen, all right? Everybody who works in healthcare knows that doesn't happen, all right? And so I said, okay. And she said, when can you come in for a biopsy? Also does not happen. How long does it take to usually schedule a biopsy to confirm what she knew she was seeing on the film? You know, and I decided, throughout the process, I was going to use all my privilege. So when she asked me that question, I said, I want to come in today. And she was like, Michelle, you know you can't come in today. I said, okay, well, I want to come in tomorrow. All right, now mind you, I had a full work week schedule. I had a community meeting scheduled because I was still working on infant mortality reduction at that time. And I said, I need to come in for that biopsy, and then you need to have me out in time for me to go do this community meeting. Right? Because the work was still just that important, right? But I had to go get this biopsy. And she said, okay, you can come in tomorrow, right? I go in the next day. It's another one of my then husband's partners, him, right? Both looking at the film, right? And because he has hand selected who he wants to do the biopsy, also doesn't happen, right? And then the nurse who took care of me, she takes me in another room to do like another shot before we get started. And she looks at me and she says, has anybody shown you your film? And I said, nope. So I had all this privilege, right? But I was still getting treated like a patient normally would. And nobody had shown me my film. And this nurse recognized, she knew who I was. She knew where my husband was. She knew why I was there. And she knew what was on that film. And she knew I knew how to read it. And she took the time to say, let me let you see what's going on with you. So I would tell you that that experience was so important to me because now I can advocate in a way that a lot of people can't. To say, I want every person who is dealing with breast cancer to have the privilege that I have. And if we're not quite there in our processes, how do we get there? How do we get to a point where that person is getting a personalized call by somebody who actually cares that they're getting this diagnosis and takes the time to talk to them, schedules them for a biopsy in a reasonable amount of time so they're not spending weeks to months worried about what that biopsy is going to show, right? Takes them through the process of getting the biopsy, which does not feel good. If anybody's ever had a breast biopsy, you know, they numb you up as much as they can, it hurts, right? And then it hurts to heal from that, right? And then while you're healing from that, you're potentially hearing that you have cancer. And that these are the options to prolong your life. So how do we get people to a point where everybody is getting treated with that level of privilege, no matter who they are or what station of life they're in? That's really the core question that we're asking here, right? Because we know that if you don't have a lot of money, if you don't have a lot of education, if you are a race ethnicity that is not overrepresented in this country or hasn't been historically overrepresented, chances are you're gonna have a hard time getting what you need, right? And I always have fun really explaining to people that the reason why I know how to talk like this is not just because I'm from Memphis and Shelby County and I grew up here and I grew up in a majority African American city, but I trained medically in East Tennessee State, in Appalachia. And that was my first experience dealing with a population of white folks. I'd never seen so many under-resourced white folks in my entire life. Like I didn't know that existed, right? And then to understand that the health outcomes, the poor health outcomes that they were dealing with there, I was a much better med student than some of my counterparts because I was like, oh, I saw this in Dr. Terrell's office in Memphis. And the only difference is that they're a different race of people, but they're dealing with the same things. They're putting stuff in the bottle they're not supposed to. The kid's teeth is rotten out. So my attendings would be like, well, how do you know that? Oh, I saw this when I was shadowing Dr. Terrell in Whitehaven, right? So I'm telling you that there are so many different ways to advocate, but really it comes down to everybody in this room recognizing what privilege you have and then making sure that people who historically have not had that privilege start to get to a point where they have the privilege that you have. If you do that, you're gonna take care of a lot more people, and you're gonna take care of them in better ways.
I totally agree. Sam?
I'm going to come at it at a different angle. So, for the room and for rhetorical question, who's your biggest advocate in your life right now? Well, let me phrase that. Who has been your biggest advocate in your entire life since the day you were born? Probably your parents. And so there's a reason for that. And that's because they know you. They hear you. They've seen your potential. You verbalize. They know your hopes and dreams. And so other people can't advocate for you unless they really know your hopes and dreams. And so let me pivot real quick from that, but keep that in your head. When you go to a job, corporate America, most people hire not people that are the most qualified. Most of the time. Don't get me wrong now. Listen to my thought fully. I want that snippet being played out by itself. Most people hire individuals that, yes, are qualified, but people that they can work with, people that they know.
That's right.
So I'll give you a perfect example. So when I first came to a corporate healthcare institution, and I kept getting these applicants for this position, a high-ranking position. And so they said, Sam, these are your people that we want you to pick from. And all three of these individuals were from South Mississippi and did not reflect the demographic in the city whatsoever. And so I did not at the time know a politically correct way of saying, no, these candidates are not appropriate or necessarily qualified. They were qualified. However, they weren't reflective of individuals within the community. So I asked the question, I said, why don't we have anybody from here? And they said they didn't know anybody from here. And I'm thinking, I know dozens of people from here that would fit this job that actually live within the community. And so that kind of clicked. It's like people are pulling people from who they know in the communities they know. So unless you have somebody that knows who you are within what you can do, they won't advocate for you. So when you go to church, when you go to school, when you go to your work, when you go to a friend's gathering, quite frankly, I did not know we had so many African American men in white coats in Memphis until I participated in a group. So now it's like when we're going down the list of potential providers for the community, I've got a quick Rolodex in the top of my head now. I was like, hey, send a quick text out. Same thing. So until we start advocating and actually start communicating what our skill sets are amongst ourselves, amongst our community, people won't know. So go beyond your parents. Talk about what you do, what you want to do, what you can do, because I promise you one day somebody will reach out to you if you do it effectively.
I like that answer. So I'm gonna ask this question. This will be our last question. I promise I'm gonna open it up for one or two questions from the audience. So we understand the political presidential climate we're in, and there's a lot of conversation around exclusion rather than inclusion. And we have spent the hour tonight talking about inclusion, being at the table, being an advocate. Just the climate we're in right now, how do we ensure that all of our work for years of our ancestors, where we are today, the work we've done during COVID, the work we're doing now, pulling in minorities to be in these jobs, does not become unknown in years to come in the conversations we're having about exclusion. So Dr. Lyons, I'm gonna start with you.
We gotta show up. We gotta keep showing up. We have to make sure that the Dr. Sampsons and Dr. Taylors and Ericas and Teds and everybody else, not only we're known in the community, but that we're actually showing up in the spaces where decisions are made. We talked about that a little bit earlier, but we have people in position, we have people with the purse strings, and we even have people who are political right here in Shelby County, Memphis, Tennessee, that look like us. They have to show up. If they don't show up, we need to get them out the way so that those who will show up will go ahead and show up. If we do that, then we can stop a lot of the exclusion that is currently happening and is going to continue to happen for the next few years. But right here in Shelby County, Tennessee, I can't talk about Middle Tennessee or East Tennessee, but right here in this little corner of West Tennessee, we have the people in positions. This is about hospital and healthcare executives right here. We have people in position that in this realm can make decisions. We have people in political positions who can make decisions. We have to show up.
I like that. Sound right.
So from my perspective, I'm a big chess player, so I'm always thinking strategically. So in this climate, quite frankly, it makes it very difficult. I mean, it makes it extraordinary. The pressures that you're feeling from the community, from politicians, all of it makes it very difficult. However, the goal is the same, and that is to help those that need it most. And so from that vantage point, the approach that I'm taking is, since everything is merit-based, at least that's the new initiative, for every individual that is merit-based, that is presented by somebody that's advocating for somebody else, I make a conceited effort, concentrated effort, to make sure I demonstrate and provide someone else of equal or higher caliber or merit that's within the community. So that's one thing I will say. There's always an old term, and that was you have to be twice as qualified as anybody else if you're a person of color. And I found that to be consistently true, and I think one of the latest reports that's come out really highlights that. Ever since they've decreased the quote unquote DEI initiatives at some of the Ivy League schools, I think they've doubled in minority acceptance rates for some of the key schools recently. So I mean, that carries a lot of weight itself, that we as a community by far have a lot more merit than we have historically been given credit for. We haven't necessarily been given the opportunity, but we want to make sure that we actually have individuals that are part of the candidacy pool to be able to be selected.
I'm gonna go, Dr. Taylor.
So what I'd say is keep the main thing the main thing. A lot of times what you're hearing right now, while very upsetting, are things that are not legal, right? So one way that, I'm trying to be really careful here, one way that people try to get you to do something that you wouldn't normally do is to shock you into doing it on your own without being forced, right? So a lot of the exclusion things that you're hearing, and like Sam said, okay, we're gonna go to merit. Well, guess what? A lot of us have way more merit, right? Like, when I think about how much school I've been to, we talked about people being underpaid and undervalued. Don't get me started, right? So keep the main thing the main thing. For us at Shelby County Health Department, the main thing is to protect the health of Shelby County residents throughout the county, no matter who they are, right? With the understanding that we are using a health equity model, which means that everybody gets what they need to live and have their optimal health, right? So that means that one person may come in and they only need a birth certificate, but 3 people may come in and they need a car seat, a pack and plate, and a test for gonorrhea, right? We're gonna give you what you need when you walk through that door. And it's not gonna matter what you look like, how old you are, how much money you make or don't make, right? And so I think a lot of it is keeping the main thing the main thing. Learn to control the narrative, right? You don't want us to say DEI, fine. I'm doing workforce development for the next 4 years. Why? Because we already been doing workforce development. Because we already need to strengthen the public health pipeline. That needs to happen. We already need to strengthen the health professions pipeline. That needs to happen. I'm sitting up here in large part because of Dr. William Terrell. All these black men in white coats that you all are talking about, I knew them back in high school and college. Why? Because Dr. Terrell used to take me everywhere. I went to every Bluff City Medical Society meeting. I went on rounds with him at the hospital. I saw patients with him. And so a lot of these physicians that you all are just being introduced to, I've been knowing. Why? Because I had somebody in that profession that I wanted to be in who took the time to make sure I knew what that life was and what I was getting into. And cared enough about the community to make sure that he was strengthening the pipeline for the next generation. So we have to keep the main thing the main thing. It is very easy to scroll through social media and get very depressed these days very quickly, right? What I would challenge you to do is either turn it off and go find a really good book to read, right? I'm reading Black Cake right now, excellent. Or, right, everything that you scroll, every time you scroll, say, is this going to affect the work that I know needs to get done within the next 30 days? I promise you, most of the time, the answer is going to be no. It just is. So just keep the main thing the main thing.
All right, thank you. Erica?
Just on theme with keeping the main thing, I have stayed away from social media as much as possible because I know that the goal is to cause chaos, right? To keep us distracted. And a few of my friends and I were talking about the reason why the Underground Railroad was secret. You know, we were able to get these things done because nobody knew what we were doing. And we kind of have to take a note from our ancestors on that. Like, you don't want us to talk about DEI, you don't want us to have balloons or whatever. We'll just do what they do. We'll just hire who we want to hire. It may be a team of all Black people. We don't have to say we're hiring all Black people. These were all the people who were qualified for the role. Nobody looks at ABC health system and says it's too many white men in C-suite positions, right? So we, as the team has already shared, when they mentioned that we would be going to being merit based, I chuckled like, oh my God, that would be great. Like that would we would be fine. But they don't even know what it means to really be merit based because they would be even more terrified if they did. But just on the theme of keeping the main thing, I don't want to say keep our heads down per se, but let's keep doing the work. Let's not get distracted. A lot of this that we're seeing right now, they're just distractions. So, and that's what we plan to do.
Thank you. I am going to take one or two questions for the audience. I know we're running for time. If there's something pressing for any of our panelists today, don't be shy.
I mean, it's a comment for me.
Go.
Well, what's his name?
Ted.
When he brought up the trust part of the community, the Black African American. Well, like my mama was hospitalized recently. We were right there about it. We didn't leave the room. I'm gonna be real with you. She came in and said she had COVID. I wasn't leaving the room. I just prayed. And I said, she gonna be okay. And I stayed right there, had my mask on, who's at Baptist. She went upstairs and she finally got her upstairs because everybody was sick, you know, in the hospital. We got her upstairs. I was still right there. We all took shifts. We all took shifts because it was one medication that I know of. I'm I'm an advocate. I love it. Dr. Spencer is my doctor. Dr. Raquel Spencer. And when I called her one time when I was sick, she was trying to give me the COVID pills to help me, but she said, Ms. Burton, you're kind of in the middle of the COVID, so we don't want to give it to you because it can mess up kidneys. So when the nurse came in with all the medication they kept giving my mom, I was sitting there and I thought about it. I said, what's that you finna give her? And she said, well, this is the COVID. I said, no. And my mom said, well, what is it? I said, it's those pills. You already had something. Whatever you have, you've had it for a minute. You're okay. She said, okay. I was in there to be her advocate, team, one-on-one, taking care of my mom.
One other question, Bill Verso, and then I'll close this out.
Well, if I may, I've been thinking real hard to instruct a question because I'm so thankful of each one of you. Actually, you made me proud of us. And I felt, and I kept saying myself, Black and Brown, how beautiful we are. And how proud I am of us. But the truth is that it is your love, because I'm amazed. I came for a Black History Month to talk about, and you brought up the Hispanics and the Latinos. How that made me so proud. The Native, I'm also Native American, so it made me so proud of you and what you're doing and what you just said. So, my mind, I could say for a question, it's what future do you see us together? Because it will be beautiful with that same love that I heard from each one of you, and I thank you. I thank you for all of our communities from the heart.
And that's what today was about, right? I think they spoke about advocacy, not just for us, but all. Who needs the help? Who needs to care? I'm gonna let Sam answer that one, and then we'll go down the line and we'll close out.
I'll be brief. Honestly, I think based on demographic statistics over the next 50 years, I don't think that's going to be so much of an issue based on population growth. And I'll leave it at that.
You know, it's hard to understand what I'm about to say, but I'm going to tell you, the future is actually bright. We know that it is darkest before the dawn. And what we are doing right now is learning who and what divides us, so that when it is time to take back over this narrative, we are all ready. Yeah. And we're strengthening all the people who didn't really realize what was possible when it came to the darkness, right? And so really use this time to get grounded, to educate everybody around you, so that when it's time for that future, it's gonna be so bright that the darkness won't even be able to come in. But right now, it has to get worse before it gets better. We have to understand that, and we have to learn how to work through that without being distracted, right? Everybody up here is pretty much telling you, stay focused. Do not let these distractions take over what you're supposed to do, because that's what they're designed to do, right? We have too much work to do. We have too much need in our community. We do not have time to be distracted.
Dr. Lyons?
Right. Said everything I was going to say. No, but I'll put it here because it tells our minister. So the devil is not in the details, the devil is in the distraction. So you're being distracted right now. We just heard that from everybody up here. Even when we talk about social media, you're being distracted. You have to stay focused. I train folks, athletes, everything. I tell them only focused folks finish. You will not finish if you're not focused. You gotta stay focused. What I mean by that, for our youth who are in here and the parents who have youth, they need to go to school. All this school ain't for everybody. Okay, as many as possible. We are starting a decline. It started about in 2013, 14. African Americans and Hispanic Americans, which actually Hispanic Americans are above us and going to college now, but African Americans are steady sliding. We need to turn it back around the way it was going. We had started closing the gap all the way up to 2013, 2014. And for some reason, something happened. I don't know which one of the rappers did it, but something happened to me that said we don't want to go to school anymore. Stay focused. If you don't prepare during times of chaos, when the chaos is gone, you'll be left behind. Stay focused.
The last thing that I'll say, just to address what you mentioned, is that I don't think we have a choice but to work together. I mean, many of us are under attack, all of us. So we are very resilient people, all of us, and we have to find more ways to work together. I would say also, just getting to know people for who they are directly instead of through like social media. The media, a lot of our identities will be attacked in various ways over the media over the next couple of years. And that is the new attack through media. So which is why you see people buying platforms like Twitter and trying to buy TikTok and like all of this, because when you control the media, you can control people. So staying connected to humans, getting to know humans. From another technology perspective, I'll also share that a lot of these executives at technology companies, they actually don't let their children and their families use these platforms because they know how dangerous they are. We liken a lot of like social media to weapons. So in the same way that you wouldn't give your child a gun, you don't need to give them Facebook or Instagram or TikTok when they're 10, 11, 12, 13 really years old. So so I would just say, you know, working together, we have to work together, we don't have a choice. Staying connected as humans and trying to stay away from the media as much as possible, especially if it's distracting or toxic.
I like it. I want to thank all of our panelists for being here. I hope everyone in the room has key takeaways. One key takeaway being you're supposed to be in this room you're in, right? Whether you're going to whatever field in healthcare, public health, government, you're supposed to be in that room. We're going to teach you in that room. And don't be afraid to be an advocate for whoever it is in that room. It will be challenging. It will be hard. You might fail at it. But do not be afraid to be an advocate as we need you, especially in Shelby County. And that message is for all of us here today. I want to thank everyone for coming out on behalf of NAHSE and the Shelby County Health Department. I want to make sure that you get your treat bags over here to the left of us. If you are in school of any kind of category, please make sure you talk to Dr. Lyons before you leave to ensure you get part of your scholarship.
That's right.
I will say this too, all of our panelists are open to mentorship or just being someone you can connect to. So please don't leave here without being connected, because that's the only way we move forward. To our panelists again, thank you for coming tonight. I know the